Welcome to the Cogtrium Telehealth platform Quick Start Lessons. The purpose of these lessons is to give you a quick start in being able to begin using telehealth. The objectives are really straightforward. At the time you finish these lessons, you should be able to add patients to the telehealth system, link providers to patients and payers, to set authorized session limits, to schedule telehealth sessions, and conduct telehealth sessions. There are many more resources on the support site that apply to special situations, conditions, and offer a lot of tips and techniques that you may find useful, and we encourage you to explore those resources. The telehealth platform required equipment is very minimal. You need to have an internet connection, a computer, webcam, and microphone. The internet connection should be sufficiently robust, such as a cable modem, DSL, or other high-speed connection. These are probably the connection types that you already have in your office. The computer that we suggest is that you use a desktop or a laptop as the provider. Having a 14-inch screen or larger is usually a huge plus for a provider. An HD high-def webcam is a good thing. It allows you to be much more visible to your patients, and also the same thing on a microphone that has the same sort of high-def resolution. These are very inexpensive. Adequate ones can be purchased online or through the big box stores for $30 or $40. The Cogtrium Telehealth platform is a roles-based system. That means the role that you have in the system determines the functions and the things that you can do. There's a role for patients, for providers, and for EAP. That's executive admin personnel. The patient role is basically to receive services. So most of the roles around the patient are about receiving calls and logging in and being able to make themselves available to the therapist. Providers occupy a central role. These are our folks that are actually providing the services. As a provider, you can schedule appointments, conduct sessions, and approve billing information. EAP, the executive administrative personnel, are the front office and back office functions of an office. These are the folks that are linking patients and providers by referral or authorizations, linking patients and payers. It's doing these administrative functions. In some cases, a provider will also act as their own EAP, especially in solo practices. That is the case usually, and in other situations, a provider may also want to act as an EAP. Choosing patients to begin initially with telehealth is an important decision. Getting up and going quickly usually means picking patients that you have a rapport with, that you have a good understanding about, and that's a good way to get started. Most of the clinical techniques that you find that work in the office, with a little bit of creativity and adjustment, they work as well online. Many of the techniques you will find actually work better online as you get the adaptations down and match them to your own personality and skill set. There is a slight learning curve for folks that have not had a significant online presence, and it takes a session or two to feel comfortable in the online setting. We advise you to jump into that and have that happen as quickly as possible. A universal effect that we see, both with patients and providers, is very quickly they no longer see the medium. It becomes as if the patient and the provider are in the same room together. There is that kind of absorption that happens. Most patients, if you'll keep this in mind, are absolutely thrilled with telehealth. Most of them just love this opportunity. And the reasons are very easy to see why. It's a removal of a lot of the barriers to care. You don't have waiting room times, you don't have travel times, you don't have parking issues, and in many ways you have far greater privacy and convenience. And those are very, very appealing to patients. Well, this completes our overview, and you should now go on to the detailed lessons to give you the detailed skills you're going to need to get the platform up and going for you. We wish you good success, and my encouragement to you is to jump in and get going as soon as you can.